mynews.studio.
A $28,000 HIV prevention injection is about to cost just $40 in over 100 countries. Could this change the course of the global AIDS response?
And today's date is October 24th, 2025. Last year alone, more than 1.3 million people contracted HIV, mostly in places where prevention isn't accessible. Why has that remained a challenge for so long?
It comes down to access and affordability, really. Take Lenacapavir, for example. In the US, a year's course costs more than $28,000. That's far out of reach for most people in low and middle-income countries where HIV rates are highest.
But now that's about to shift. There's a new international deal to make generic Lenacapavir available for just $40 a year, starting in 2027. That's a huge price cut. How exactly is this being made possible?
It's a joint effort. Governments, global health groups like UNAIDS, and manufacturers, Dr. Reddy's and Hetero Labs among them, are working together. By allowing generics and organizing bulk purchases, they've managed to cut the price by more than 99%.
And Lenacapavir only needs to be injected twice a year, right? That's quite different from the daily pills people are used to.
Yes, just 2 shots a year. That changes things for adherence. Instead of a daily reminder, it's just twice annually. Clinical trials have shown nearly complete efficacy in preventing HIV transmission.
But how will health systems actually get this to everyone who needs it, especially in rural or low-resource areas?
It'll take several coordinated efforts. Governments and NGOs are launching education campaigns, training health workers, and adding Lenacapavir to existing HIV programs. Community leaders are key for spreading awareness and helping to reduce stigma around injectable prevention.
Stigma's still such a big obstacle. Are these campaigns really going to connect with people most at risk?
That's what they're aiming for. By partnering with local groups and using trusted messengers, the hope is to build trust. Plus, by integrating into current HIV services, they can reach people who are already engaged with the health system.
There's also the supply chain. If demand rises quickly or there's a disruption, how do they keep the supply steady?
They're putting robust systems in place, tracking inventories, making agreements with multiple suppliers, and setting up rapid response plans. International funding should help keep everything running.
Is there a risk that HIV could develop resistance to Lenacapavir now that it'll be used so widely?
That's under close watch. There's ongoing monitoring for safety and adherence, and any breakthrough infections get investigated. There are protocols for resistance, and digital tools will help track usage patterns in real time.
Compared to daily pills, do these twice-yearly injections actually improve adherence in practice?
Early studies suggest they do, but as the rollout grows, researchers will keep collecting data through patient surveys and health records to see what works best in different settings.
So in the bigger picture, this could help the UN reach its goal to end AIDS as a public health threat by 2030. Is that realistic?
It's a crucial step, but it depends on continued funding, education, and building strong infrastructure. The science is solid. Now the challenge is making it work everywhere it's needed.
So, international teamwork and new approaches are pushing health equity forward. What's next for HIV prevention worldwide?
Next comes scaling up access, monitoring real-world outcomes, and taking the lessons learned here to tackle other diseases where cost and delivery are barriers.
A $40 injection could be a turning point in the decades-long effort against HIV.
If it succeeds, millions could be protected, healthcare costs could fall, and the goal of ending AIDS might finally be within reach.
Thanks for joining us. This episode was powered by mynews.studio. You can try it free today.